We have another question here. How long does a positive COVID patient remain infectious to others? And this can be answered by both Dr. Siegel and Dr. Varbe.
So it's I think it's a bit it's a tricky question to answer because we don't exactly know how long after the end of symptoms the patient will keep have viruses and so potentially can keep transmitting. I think that when they discharge people from the hospital, they ask them to be very cautious with interacting with others during quarantine time. So maybe a kiss will validate or not this, but I think that's the case. And there's also working. We hear of people like, especially in this Sinai study that has been posted as a preprint recently, they were able to detect the viral RNA inside the patient for many days after the production of antibody and the disappearance of symptoms. So there's still a question that we don't really understand here is whether the fact that we can detect the RNA means that people are producing infectious particle or they are just like shedding RNA without necessarily producing a particle that could still be infectious. So I think that the jury is still out and people need to be careful, at least for a few days, maybe a few weeks. I don't know what the recommendations are, but when their symptoms get better to make sure that they would not infect other people.
Dr. Siegel, what do you think?
I completely agree. I think that this is a very, very difficult question to answer, and we don't have good guidance yet.
Okay, thank you very much, Dr. Vapre and Dr. Siegel.